Welcome back, everyone. When it comes to skincare, we don't always realize how risky our sun-loving habits can be. Well, here to give us the scoop on how we can lower our risk of skin cancer is board-certified dermatologist and co-host of The Doctors, Dr. Sonia Batra. Welcome back.
Thank you so much.
Yes, we're happy that you're here, and we're equally happy to be talking about this subject because May is Skin Cancer Awareness Month, right? And skin cancer is so prevalent out there. So let's talk about some of the most common types and ways, well, I guess ways that we can prevent them as well. We'll get into that.
Yeah, absolutely. So thank you for having me back. I appreciate it.
Of course.
And with respect to the most common types of skin cancer, far and away the most common are non-melanoma skin cancers.
Okay.
So the #1 cancer of any type in the United States right now is basal cell carcinoma, which is not what you usually think of. It comes up as a pink pearly bump that just lasts for a month or more.
Oh.
It never heals. This is a really good picture of one where you can see how it's just kind of eroding the tissue around it. That darker stuff is actually like a little bit of bleeding and crusting. So if you get a sore like this could certainly be a basal cell carcinoma and warrants evaluation.
And something that won't go away.
No, exactly. So my litmus test with my patients is usually if it comes up and it's there for a month or more and you can't explain it, it's not a pimple and it's not healing, then you definitely should have someone take a look at it.
Okay.
And then the other really common type to look for is something called a squamous cell carcinoma. And far and away the non-melanoma skin cancers are the ones that if your relative or your spouse or someone has had a skin cancer, it's in this category.
Okay.
And squamous cell carcinoma, here's a great photo of one, are usually scaly, crusty spots. Sometimes they come up very quickly. And these together account for over 3 million cancers each year in the United States. Thankfully, completely curable if you catch them early. These are the ones that just need to be cut out or removed in some form or fashion and very rarely spread elsewhere in your body or harm your general health.
Okay.
Now, the one we like to bring attention to, especially in May, is melanoma, because even though it's much more rare, it actually is increasing in incidence, and it's by far the most lethal form of the skin cancers. So with this, here's a good picture. We always talk about pigmented spots, so a mole that's changing, and we use a specific criteria called the ABCDs, which you may have heard about. It's asymmetry, meaning you can't put a line through it, so it looks the same on either side.
Okay.
The B is for border, so a blurry or irregular border. The C is, like in the photo, for variability of color, and the D is for diameter. So something that starts out small and starts to expand. Our cutoff is usually about the size of a pencil eraser, which is 6 millimeters or a 1/4 inch. And that's kind of when it's getting a little too large for comfort. And 50% of melanoma arise from pre-existing moles. So if you have a mole that you've had for many years, and it's always looked kind of crisp and brown and well demarcated, and it starts to change in a way that it's more dark, jagged, or irregular, that's something to watch for when it comes to melanoma.
I'm going to check all my moles as soon as we're finished.
I'm so glad you will.
I mean,
Good.
honestly, every time we talk, and then I go in the bathroom, I'm checking everywhere. But there are some things that we can all do to help avoid this and to deter any sort of skin cancers, and that is using broad spectrum sunscreen. However, what is the difference between UVA and UVB rays? I never quite understand this.
Well, that's a good question. It's actually a very sophisticated question.
I'm always so
because
confused.
they are different wavelengths of light. So UVA is typically longer and it's more penetrating. So that's the one that's actually going to come through your window in your car on your driver's side. It's more directly implicated with wrinkles and brown spots. Now, the UVB is what we all talk about when we talk about sunscreen specifically, because the SPF rating on your sunscreen only applies to the shorter wavelength UVB. And the reason that's so important is because it's a little bit more superficial, as you could see from the diagram, in terms of its penetration, but it's much more likely to cause sunburn, and it's much more fastly kind of linked with developing skin cancer.
Oh my God.
So when you think about the carcinogenicity of UV, it's often attributed to UVB, but both UVA and UVB can contribute to skin cancer formation over time.
Good
I mean,
question,
I don't think a lot of people knew that.
No
I always
way.
get
There's
so
no
kind of
way.
like,
I didn't know.
What does that mean?
No, for sure.
Thank you
doesn't.
for
But
clearing
to your
that up.
point, broad
Yeah.
spectrum means it blocks both UVA and UVB.
Okay, so we got to get that broad
Exactly.
spectrum.
So it's worth the
Yeah.
extra 50 cents.
It
Yeah,
is,
yeah,
because
right,
when
no
you see
kidding.
with SPF, it only applies to the UVB. So you're only talking about the shorter wavelength,
Right.
smaller part of the spectrum.
Now, how about this, though? How about if we were kids, like this guy right here, got a lot of sunburns as a child, even though I may wear sunscreen or anybody may wear sunscreen now, do those previous sunburns as children, do they sort of increase our chance of developing skin cancer?
Yeah, unfortunately, that's the biggest bummer around
Oh,
because
no.
you may have seen the light, you may be wearing your sunscreen and doing everything right now, but there was a very large study that was done on women and found that if they had 5 or more blistering sunburns between the ages of 15 and 20, their lifetime risk of melanoma was 80% higher, and for non-melanoma skin cancer was 68% higher. So just those ages before the age of 20. So while it's still very important as an adult to wear your sunscreen, if you're a parent and you're watching this, it's so critical to prevent those blistering sunburns in your kids, because we know that drastically increases their lifetime risk of skin cancer.
How much sunscreen are we actually supposed to apply?
So it's a really good question, too,
Because I
because
never
none of
know.
us apply enough.
Yeah.
So here's a good visual for you. When they talk about SPF and you see this is 1 ounce or a shot glass full of sunscreen, this is what you should be applying each time to your body when you go out in the sun. And so very few of us actually do that. And it's quite a lot. Like, so your average bottle of sunscreen that's like 1.75 ounces should really only last you for 2 applications in the summer if you go to the beach.
Now, what about the spray one?
So the spray one's the rule of thumb is you need to do 4 passes back and forth. And I tell my patients, just look till your skin is glistening. And that's generally going to be enough, and you can rub it in. Just remember with sprays, you never want to spray directly on your face. You want to spray it into your hands and then put it on your face. And then also sprays, though they're very effective and people love them for their convenience, you want to be a little bit careful about inhaling them and also applying them anytime you're near a barbecue grill or a fire or anything that could potentially ignite that spray. So just be cautious, but they're super
be the end of
convenient.
that party,
Everybody
sure.
likes them. Yeah.
Oh, boy.
That's not good
Talk
enough.
about getting burned.
No, we got to.
Yeah.
Speaking about getting let's talk about SPF numbers, okay? Because we hear that SPF 30 is sufficient, but is it true? Is that? Or should we be looking for a little bit higher
Or
SPF?
50?
I mean, how high should we go?
Yeah, 30, you're right. 30 is enough. Actually, at an SPF 30, you're at a 97% UV block. So that's pretty good. Even if you go up to an SPF 50, you're only at a 98% UV block.
So that's 1%
so it's a
more
very
for that.
small
Oh, my goodness.
incremental difference. So sometimes just sticking with the 30, which is plenty, and then remembering to put on enough, and then certainly reapply sufficiently, like every 2 hours if you're out and about, and every hour if you're in water. That's where you're going to have adequate protection.
And vitamin D absorption is still
Yeah.
okay with SPF? You still get your vitamin D from
So
the sun?
you probably, if you're using a good mineral, broad spectrum sunscreen, you might not get your vitamin D as you otherwise would. But what I tell my patients is that don't worry about getting the sun. The sun is fine. 10 minutes a day, you'll get adequate vitamin D. Most of us need 400 to 800 international units a day. But what you want to avoid is being out to the point that you're red or you're pink, because
Right.
that's when you're accruing the damage that's concerning. So dermatologists don't hate the sun. We hate sunburns.
Right.
So if you can get that 10 minutes a day and then put on your sunscreen, that's great. If you can't, just remember 80% of skin cancer is on the head and neck. If you can get the sunscreen there, great. Otherwise, a broad-rimmed hat is a great idea. Using a lip balm that has SPF is a great idea, because what many of us women don't realize is that when we're putting gloss on our lips, it's just like putting baby oil. In the old days when we used to use it to tan, it decreases scatter of light, and you're more likely to
I thought it would
damage.
block it.
Super
No,
helpful to hear all
yeah.
this.
So
it really
reapply
is.
that lip balm with SPF every hour or so, because we're all eating and drinking and speaking, so it comes off a little
Thank you
more
so
quickly.
much, Dr.
Thank
Batra.
you.
So great. I mean, there's a lot of great stuff there. For more information, visit batraskincare.com.